LGBTQ2S+ is a diverse community with unique health needs requiring culturally competent and inclusive care. The acronym LGBTQ2S+ stands for lesbian, gay, bisexual, transgender, queer, two-spirited, and the plus recognizes additional sexual orientation, gender identities, and expressions. Despite making up an estimated 3 to 4% of the populations, members of this community often face significant barriers to accessing safe and respectful healthcare. This is a personal topic to me because my brother is part of the LGBTQ2S+ community. Seeing the challenges he has faced has inspired me to advocate for better healthcare practices for this community. Inclusive care is essential for ethical nursing and building trust with patients. Cultural competency in healthcare means understanding, respecting, and addressing the diverse needs for all patients. For LGBTQ2S+ individuals, this is critical to reducing gaps, building trust, and ensuring safe and inclusive care. For example, 77% of sexually and gender diverse youths have been a target of bullying. 13% of individuals experiencing homelessness identify as LGBTQ2S+. 3 out of 10 LGBTQ2S+ people report their mental health to be poor or fair, compared to only 1 out of 10 non-LGBTQ2S+ members. When Canadians were asked which population faced the most stigma, 55% of responders pointed to transgender individuals. The top stigmas these communities face, according to Canadians, include being shunned by family, verbally harassed or threatened, feeling misunderstood by others, being physically harassed or threatened, and facing online harassment or threats. Negative experience with healthcare providers often discourage LGBTQ2S+ individuals from seeking care. A lack of knowledge among providers about unique needs further complicates the issue. The Government of Alberta explains a number of gaps exist in programs promoting health equality and interventions by addressing social determinants of health for sexual and gender minorities in Canada. And efforts to develop new programming should consider the LGBTQ2S+ communities who are underserved. To address these challenges, nurses can take the practical steps to create a more inclusive environment. Take steps such as using gender-neutral language. This avoids using assumptions. Asking open-ended questions give the person more of a chance to share information. You may ask, what pronouns do you use? As well as not using prefixes such as Mr., Miss, Mrs., Sir, and Madam, unless the patient says they prefer it. This helps also avoid assumptions and builds trust. Trauma-informed care is also essential, ensuring patients feel safe, respected, and understood, especially if they've experienced stigma or discrimination in the past. To improve care, we must prioritize inclusive education for healthcare providers and advocate for policies that create safer, more welcoming healthcare environments. We are all human and make mistakes. If you make a mistake, forgive yourself and apologize. A simple apology goes a long way. For patients, there are numerous resources available to help them feel supported and meet their needs. Local organizations like Pride Center of Edmonton, Brightline, and Calgary Pride offer services, advocacy, and community events. National groups such as PFLAG and EAGLE provide education and support to advocacy equality. These resources can be extremely useful in ensuring patients feel seen, understood, and supported. For nurses and other healthcare providers, there are excellent training opportunities to enhance cultural competence. Alberta Health Services offers courses like 2S LGBTQI+ Basics, Building Safer Spaces in Healthcare, and Diversity Inclusion modules. These programs help staff understand unconscious biases and learn how to provide inclusive, respectful care for people from diverse communities. By participating in these communities, nurses can gain a deeper understanding of how to support the LGBTQ2S+ patients effectively while fostering a welcome and inclusive environment. Programs like SOGI Nursing also offer education programs for nurses to better support the LGBTQ2S+ community, including 4 virtual simulation games in various healthcare settings. These simulations are accessible without enrollment to anyone who would like to learn more about how to support the LGBTQ2S+ community in their workplace. By utilizing resources, nurses can improve their availability to provide respectful, inclusive care and create a safer, more supportive healthcare environment for everyone. As a nursing student, I've learned the importance of creating a safe and inclusive environment for all patients. Offering pronouns during introduction or asking them respectfully helps patients feel seen and valued. Protecting confidentiality and ensuring consent before sharing personal information is vital to building trust. Licensed practical nurses are expected to provide safe, competent, and ethical care, with cultural competency being a key part of this responsibility. The College of Licensed Practical Nurses of Alberta outlines the standards of practices, codes of ethics, and entry-level competencies that clearly define the needs to understand and address biases. Biases can affect patient safety and coworker relationships, so it's important to be aware of them and communicate respectfully. As future nurses, we should treat everyone as unique individuals, avoid generalizations, and use inclusive language. By following the CLPNA's guidelines, we can create an environment that fosters inclusivity and trust, ultimately improving patient-centered care. In conclusion, culturally competent, ethical, and inclusive care is not just a professional responsibility. It's a human one. Respecting everyone equally, regardless of their identity or who they love, ensures that healthcare is truly a safer space for all. By using respectful languages, addressing unique health needs, and integrating inclusive assessment tools, we can create stronger relationships and improve outcomes for the LGBTQ2S plus community. We are all human and deserve to be treated with dignity and compassion.